take care of you. All you may need, He will provide. God will take care of you. Nothing you ask will be denied. God will take care of you. God will take care of you through every day or all the way. He will take care of you. God will take care of you. No matter what may be the test, God will take care of you. Lean weary one upon His breast, God will take care of you. God will take care of you through every day or all the way. He will take care of you. God will take care of you.
Gentlemen and ladies from wherever you're watching us, we're grateful and I'm privileged to say good afternoon. We are not in very comfortable times. All of us must be aware that the whole world is not in comfort because of what everyone knows about COVID-19, a viral infection that has ravaged the globe, killing thousands of people and very many others who are still sick in several hospitals around the world. And this is the subject of our discussion this afternoon. With me are two gentlemen, my friend Dr. Baruku Joseph and my friend Dr. Keith Baleta. And before we go into the discussion, you allow me to have a little introduction so that everyone is comfortable with whoever is going to be sharing in this discussion. My name is Samuel Kasibante. I head the Department of Clinical Laboratories at Jinja Regional Hospital. I'm a specialist in laboratories, in clinical laboratories and diagnostics, and a candidate for a Master of Public Health. Dr. Baruku Joseph is a medical doctor with a specialization in internal medicine, and he works with Mulago National Referral Hospital in the Department of Internal Medicine. I'm also privileged to say that he's an MBA, and he's going to be part of the panelists sharing in this afternoon conversation. Dr. Keith Baleta is a medical doctor, a Master of Public Health, and he works with the USAID URC project, Rights EC. I wish to apologize, and I'm apologizing that Dr. Sempira Joshua is not with us. He felt unwell and he couldn't participate in this discussion. But I'm exceedingly very comfortable that the two gentlemen and myself will give a good share of the discussion to try and add to the information circulating about COVID-19. I want to request my brother Joseph Baruch to greet the people viewing us, and later Dr. Keith Baleta will also send some greetings before we can start the conversation.
Good evening, viewers, and thank you for viewing us. As they have said, I'm Joseph Baluku. I look forward to your questions through the different platforms that you will be sending to us. Thank you.
Dr. Keith?
Good afternoon, viewers. We're happy to be with you this evening, and we hope that we'll be able to present you with information which empowers you to protect yourselves and stay healthy.
Thank you, Dr. Keith. You spoke exactly like a public health consultant, ensuring that health is promoted and everyone stays safe. Ladies and gentlemen, I want to start ushering us into the discussion about COVID-19. It is no secret now. It's no secret now that everyone is aware of COVID-19. And I want to start by asking Dr. Keith to give us a status update, both nationally and maybe globally, about this epidemic. How is it, and how are nations coping with the epidemic?
Thank you, Samuel. Thank you, Samuel. We would like to start with, like investigators would do when they're investigating a case or crime. We will look for the spike, what they're doing, and assess what are they doing, who is involved, when did it take place, where did it occur, what disease, what is COVID-19? I would like to say that this is a viral disease belonging to a family of viruses called the coronaviruses. Many people think that coronavirus is just one disease. It is a group of viruses, approximately 30 to 60, but usually around 4 to 5 affect human beings. The rest tend to affect other animals, including pigs, chickens, and of late even it has been discovered in other mammals like bats. Among humans, we tend to have the common cold. We have 2 SARS, which stands for severe acute respiratory syndrome. We have MERS, which is Middle East Respiratory Syndrome. And now we have the new coronavirus disease 19. Why is it coronavirus 19? Because it was discovered in 2019. It belongs to the coronavirus, and it is new, never seen before. I have tried to describe and explain a little more about the what. When we go to the who is, maybe we could start with the where. The where did we first notice this disease? It was first noticed in China in December among people in a province called Wuhan. Why Wuhan? It is suspected that, first of all, this disease, is, as I told you, is new, and so first noticed among people who were admitted in the middle of December, around December 18th. And interestingly, all had an association in their history taken which was linking them to a food market where they were keeping wild animals for food or selling wild animals for food. From that environment, you're able to get where this started, and it has since spread. Of course, air travel enables us to move very quickly from one point to another. And as we talk, it has spread mostly to Europe, and from Europe on to the United States. It is a little less in the southern hemisphere, but is catching up steadily unless we take interventions to reduce the spread. Which place is most hard hit? Of course, China for Asia, Italy for Europe, Britain is increasingly and steadily increasing, so is Spain and France, and so is the United States, which now has the most cases, over 80,000. When you look about who is most hard hit, you still have to look at not just how many cases are there, but who is affected the most. And when you come back, you realize that China has the most deaths. In addition to that, you find that Italy also has a steadily, very unsustainably high number of deaths, between 500 to 900 on a day-to-day basis. And the United States is picking up quite quickly, not forgetting Spain and France. In Africa, we have been helped a little that the mortality from this disease is not very high. By talking of mortality, I'm talking about the number of deaths from the disease. I would like to talk about who is still most affected. The age group above 60 to 70 to 80. From that age group, the mortality doubles for each 10 years that you have it. If it is at 60, it keeps on increasing and doubling to 70 and on to 80. And of course, 90 and above. So you can see that most at risk are of dying are those older. Not to mention that even the young are at risk of severe disease. I would like to say too that in this group, of course, they have very many other diseases, what we call comorbidities. And so because they have other diseases, their risk of death is increased. When you have one comorbidity, it is around 20%. When you have two, it is around 28%. When you have 3 or more diseases other than this disease, you climb to around 48%. So the more you are at risk, the more you know what to do. I explain this because we need to understand who is most at risk and what needs to be done. I would like to say too, of course, by occupation, health workers have an increased risk because they're exposed to people with this kind of symptoms. We also need to note that youngest children below 1 year or 5 years and below have a higher risk of getting this disease too. Of course, the middle-aged and the young have a moderate risk, but the immune systems can somewhat peak with this, survive with this disease. To mention to you that around 80% of people with this disease have a mild form of the disease with more like cough and a fever. Some people think it's a flu-like illness. I want to differ. It is a misnomer to call this a flu. It tends to affect and start with more of cough and a fever. And then around 13% have severe disease and need hospitalization. And of course, a smaller proportion of around 5% are highest at risk of death.
Okay.
We have talked of the who, the what, the where, and the when.
Okay.
Thank you. I
Thank
need
you.
to start and end with the how.
Okay.
This is a disease which is spread from person to person. Of course, we spoke that it started probably in animals because we have what is called the host, the agent, which is the COVID disease, and the vector, the one who spreads the disease from one person to another person. Initially, we could talk of an animal possibly, but now it spreads from person to person via 2 means. The first being that either you get it by contact or you get it by airdrop, meaning that if somebody coughs or possibly sneezes, then they have a chance of spreading it from one surface to another. For now, I'll stop there.
Thank you, Dr. Keith, for the wonderful input. And I wish to engage Dr. Baluku with wondering, why must we be concerned? One, the case fatality is quite low. In China, it leveled at 3.3%. In Italy, it spiked around 5.3 up to 8.3 fatality rate. Several people are probably getting well. Why must a person be so concerned? You know very well that a number of cities are now locked down, the streets, no one. Why should we get concerned from a medical doctor's perspective?
So I think you raise a very important point, and a good number of people have been thinking it's a small disease, it's killing few people. Tuberculosis kills more people.
Yeah.
So why should I be concerned? And the reason for concern, there are probably 3 reasons. Number 1 is that this is a new disease. And so we do not know the long-term complications that are going to come from the infection. Observations from a previous Zika outbreak that occurred in South America, there were many children born who had deformities, who had problems with their brain development. And so we do not know what will arise in the long term in this disease. So that's number 1. Number 2, for countries that have older populations, they are likely to see many deaths. And so we do not know whether our healthcare systems will be able to handle the burden that this disease is going to present. As you are aware, probably in Italy and Spain, healthcare systems are completely ran over. They're overwhelmed by the number of cases. And so if we can prevent the number of cases, then we are confident that fewer people will die. Because if you have so many cases, they'll be admitted in hospitals, they'll take up all the ICU beds. That implies that all the other diseases we've been struggling with, HIV, tuberculosis, hypertension, diabetes, we're not going to treat them. And so people are going to die. There's going to be an excess rate of death from other diseases other than COVID-19. And so I think we need to be concerned. Thirdly, is that compared to the other diseases, the other outbreaks we have had, such as SARS, as you mentioned, which occurred in 2003 in China, or MERS, which occurred in 2012, this disease seems to spread a lot faster than the others. So one person probably can affect about 2 to 3 people, which has not been the case in the past. And so it's important. And I think also the fact that almost anyone can get infected also raises concerns. I think MERS affected mostly people who were older, about 60 years and above, but here we are, anybody can acquire this infection. And so I think that's a reason for concern. Of course, the modes of transmission, as he has described, you imagine surfaces become very important. And not all of us are taking care of these surfaces. Just the doorknob is important. The table is important. The keys, the pen, the paper that you hand. And so people are not taking precaution. And whereas other outbreaks, we're strongly, especially Ebola that we are accustomed to, is strongly transmitted via contact to fluids, and which is not something we are accustomed to, that just touching a piece of paper can actually increase my risk of acquiring the disease.
So in essence, Dr. Brook was saying that we ought to be so concerned. One, usually we are concerned if the disease kills somebody instantly.
Yes.
Or if the disease goes into severe status in a short while. But as Dr. Baruko is putting forward to us that this is completely a new what? A new disease.
Yes.
And we have little information about it. From how does it affect a person? If I get it today, God forbid, what do you expect as a medical doctor that will happen to me? So that we paint a picture. You know, several Ugandans will only believe if somebody paints for them a picture of how a sick patient does what? Looks like. You know, we have a challenge that if our people have not seen it, they won't have any behavioral change.
So the good news is that the majority of people will actually have very mild disease.
Okay.
In fact, there are people who will not develop symptoms at all.
Okay.
I know that tells you that the biggest number of people are out there who might be spreading the disease, but they do not know, and even you cannot know. And so that's a concern. But it's good news at the same time.
Okay.
And so those who will have mild disease will probably experience, almost 98% of people will experience a fever. 98%. Strongly followed by fever is a cough, and that occurs in more than about 67%. And then there's shortness of breath. Now, this is difficult in breathing. This is in people who have moderate disease, moderate symptoms. There have been reports that you might actually experience fatigue in about 66% of people, just feeling general body weakness. And then a small proportion of people, probably 15% that Keith talked about, will experience severe shortness of breath that will require them to be helped to breathe, including the need to be admitted to ICU. And that's a small proportion. And as he has already said, this is more likely people who are old and they have pre-existing conditions such as diabetes, hypertension, asthma, people who smoke, people who have cancer. They are more likely, therefore, to have this sort of severe disease. But the majority of people, over 80%, are likely to have mild symptoms. And then the disease probably will just stop by its own. Somebody will just improve in just a few days, and they will not know that they actually had COVID-19.
Okay, thank you so much, Dr. Baruch. Therefore, it paints a picture that we can all avoid the disease where necessary, since it affects quite a number, quite few people, like you put it. And I wanted my brother Keith here to tell us the state of issues in Uganda today about this COVID-19 from a public health perspective. How is COVID-19 manifesting in the country? What I know for a fact, that the president shut down a number of issues. There are fewer parastatals working. Even public transport is put on hold. Can you share with us the numbers of cases that we have so that we get to know the background upon which the president is taking these decisions?
Thank you very much, Samuel. I would like to state that as of 1 week ago, in fact, one Sabbath ago, we knew we had 0 cases, and we were praying to God to keep it that way. But by evening, we had 1 case, someone who had come in on the 21st by Ethiopian Airlines. His only symptom was a fever. As we talk today, we have 23 cases. I would say that most of these, close to 90 and above, are people who came or imported cases. Probably they came from Dubai, as has been stated. I told you we use the 4 Ws and the H. Who, where, when, what, and how. So most of them seem to have come from Dubai by plane, meaning that the plane is a risk. Coming from a country with this is a risk for this. And because of that, we are still in a state whereby most of the cases are still imported. But a few, there was a baby and some other gentleman in Adjumani so far for the clear cases, which seem to become and point to community transmission. We are transitioning away from imported cases to community transmission. And if you look at Italy, I'll give the case study of Italy. The failure to recognize that community transmission was occurring resulted in a very huge, this I would like to state one simple terminology, what we call the reproductive rate. Reproductive rate is the rate at which the disease, an infectious disease, multiplies from one person to the next. This disease has a reproductive rate of between 2 to 2.5, meaning that for every one person, there are 2 people who will get the disease whom they have come into contact with. If we look at the rate of Uganda, we started at 1 week ago, and now we're talking of 23. Probably there are more because they came in, and these are people who are identified from the people who are probably already infected. However, at this rate, it means in the community there are another, for the 23, there are another 2. So probably we stand at around 50 at minimum of people with the disease already in our environment. And if we do not take public health measures to reduce the spread from person to person and reduce the spread in communities where people are so many, we stand a high risk of having an outbreak like Italy's, as Dr. Joseph said, which can overwhelm the health system, and other people with other diseases cannot be helped, one, because this is a disease which kills very quickly, and if the cases are too many, then we'll not be able to even manage them accordingly, and you'll begin seeing high death rates as high as those in Italy. So we say flatten the curve. Take interventions which will protect the spread from one person to another. 2, we say stay home as much as possible to reduce your contact with people who are in situations where people are very many. By doing that, you are reducing the impact of you possibly getting the disease. And if you got the disease, being taken to the health system when it cannot support you because there are too many. And when you do that, we can, by the grace of God, stay healthy and stay alive. Thank you.
Thank you, Dr. Keith, for that wonderful input. So, which means you justify that actually what the Minister of Health is doing and the recommendations the President is putting forward are part of the very many measures that we should have actually imbibed to ensure that this disease doesn't spread from one person to another. What is its epidemic speed in your own rating? You've talked about a reproductive rate of 1.5 to 2.5?
Exactly.
Okay.
2 to 2.5.
2 to 2.5.
1 is on the low side.
Low side. So effectively, on the higher side, one person can infect 3 people.
At minimum.
At minimum. But you can even infect more.
Why not?
So which means a family of 7 can all get infected by one single person.
Exactly.
Oh, quite interesting.
Yeah, but you see, I think that the number of cases we are reporting as Uganda need to be put in context of our testing capacity.
Okay.
Yeah, so if a country, I think as of yesterday, we have not tested more than 500 people. Probably there are about 400 people. And so if you are testing only 400 people and you find 23 cases, it implies there is a lot more that you are actually not seeing because you're not testing. So I think it is deceptive for us to think that we have few cases
Okay.
when we are not testing so many people. Yeah, and so we encourage people who think they have symptoms such as cough, fever, flu, report to the health facility and you get tested. Call the toll-free lines that ministry has supplied and such that they can link you to testing. Because it is most likely that we are reporting very few cases because we are under-testing. Yes.
Dr. Baluku, people have alleged that this is not a disease for Africans. The few Africans are just unlike a fox who walked around and by chance, probably because of the infective dose, they found themselves diseased. Africans a little bit privileged in the face of COVID-19.
Well, I think that's not supported by evidence so far.
Okay.
And one of the theories, as I've already explained, is that probably we're not diagnosing, we're not testing. That's why we are saying we are reporting few cases. Okay. And there seem to be some sort of relationship.
Thank you, my friends, and everyone who is watching us in the conversation about COVID-19. And before me and with me is Dr. Baluku Joseph, a medical doctor from Mulago National Referral Hospital. He works with the hospital in the Department of Internal Medicine. And my friend, Dr. Keith Valeta, who is a specialist in public health and a medical doctor working with the USAID project called RIGHTS EC. We're discussing the contextual issues around COVID-19, an epidemic that has caused the death of very many people and that is still spreading. So far we have tackled the issues around the epidemic, and we've put it clearly that the epidemic, one, is new, it is spreading, and secondly or thirdly, we have no treatment as yet and no vaccine. And we want to pick it from there with Dr. Baluku to give more clarification on the issue of chloroquine, because people had started to hoard chloroquine for just in case. So we want you to throw more light, as Dr. Keith will also throw more light, on whether chloroquine has any protection against COVID-19.
So I think the overarching idea is there's no need to self-medicate.
Okay.
We do not know what works now or what does not work.
Okay.
And so there have been reports of actually people who have died because of chloroquine overdose. I would strongly therefore discourage people from self-medicating with any unknown treatments.
Okay.
We've had stories of drinking jik, people drinking alcohol hoping that now that it can work on the hands, surely if I drink it should be able to kill the... all these reports, really, these things have not yet been studied extensively to justify their use. And so we strongly encourage that if you have symptoms, you go to a health facility. What you're calling cough might actually be tuberculosis. It might be something else altogether. So chloroquine, there are studies, it's under study to see if it works or not. It's too early to call.
Okay, thank you. Thank you, Dr. Baruch. So the recommendation from Dr. Baruch is that you shouldn't self-medicate. Generally, that's a good practice. Do not just hear about a drug or Google about a drug and then you self-medicate. And as he has put it so far, we have no study, and in medicine it is always conclusive empirical evidence. We don't just listen to rumors and start using drugs. Thank you, Dr. Baruch. Dr. Keith?
Thank you, Samuel and Joseph. We're building on what you said. Of course, ever since this outbreak, no longer an outbreak, a pandemic.
A pandemic, too.
The difference between an outbreak is that it is localized. It's an epidemic which is localized to a certain geographical location. A pandemic, when it involves almost all the continents, of the world, probably except Antarctica, because almost there are no people there.
There are no people there, true.
So in the case of this one, so far there has been a lot of global goodwill, and using, I would say, in research done in the lab, they have so far identified around 75 compounds, some already existing drugs, which seem to have activity or seem to work against the coronavirus disease 19. But that is in the lab. When you test the drug versus the virus, it's up to 75 compounds. Some already existing drugs like chloroquine, some like ARVs, including the drug called remdesivir, which was used to treat Ebola, eventually found could work against Ebola to some extent. But they have not been confirmed with a lot of certainty in humans that they can probably work.
Okay.
I can say that chloroquine is a unique drug. It comes from a tree called cinchona, from which we derive quinine, and you adjust it and you get chloroquine. It has been thought in theory to prevent the entry of the virus into the cells. And has, because of that, seemingly it is adapted to that cause. However, the only research has shown probably that it was among very few people in France. And when the results of that study came out, they did not look at whether it actually, if the people recovered, it just looked at whether they cleared the virus. And of course, there was a faster rate of clearing within 5 to 7 days. However, we don't know if the people were alive at the end of the 5 or 7 days. The researchers kept quiet about that. So, bearing that in mind, Trump saw this and became very excited about it and sent a message on all social media. Since then, researchers in America have taken it up and are carrying out some big research in New York, because there's a big population of people who have got this disease. Soon we will have more clear information whether actually it does help or not. As we said, for most people, they will have mild disease. And as you know, most viral diseases do not have cures. But like if mild disease is similar to others where they may have a fever, so Panadol may be of more help than chloroquine. I would like to state that, or something to ease your sore throat if you do have one, may be of help, or IV fluids may be more of help than the chloroquine. In Nigeria, some interesting woman had that chloroquine does cure this disease, and went and bought chloroquine, but the chloroquine she bought was for treating chickens. You know how chickens get malaria? And probably it wasn't meant for human consumption. And she died because of the drug rather than because of the disease. So unless, I wouldn't encourage people to go. The prices already are very high, probably 120,000 or 80,000 right now, meaning that it's not yet necessary for you to get that. It's better for you to prevent it.
Thank you so much, Dr. Keith, for that input. So as we talk now, we have no treatment, we have no vaccine for COVID-19. Therefore, no one should come lie to you and then take your money thinking that it will help you with COVID-19. Then there is this issue of masks. When you walk around town, there is an emergence of masks. Do masks actually help out in COVID-19, worn by the population?
Thank you, Samuel. I would like to state that who should put on the mask is the first question. Category 1 of people who should put on mask are people who are coughing or sneezing, because we don't want you to spread it to others. If you are a caretaker of such a person or you are a health worker, I would encourage that you put on a mask. It may not be necessary so much for everyone in the general population to put on a mask, because you stand a chance of now what they call contact spread of the disease to yourself, assuming that you move in an environment where someone has it, and from there you are removing it and you touch the front of the mask. Of course, your hands will now be contaminated. And if you are removing it carelessly, instead you may give it to yourself. You may dispose of the mask badly and you contaminate yourself.
Okay.
Then the next question, which kind of masks should I use if I have to use the mask? My second one is that they are on the market. I've seen what they call cloth masks, which are fancy. Someone probably selling them on the street. Those ones protect you 10% against the virus.
10%.
10% likelihood that the virus, there's less than 10% protection from the virus. There are then the surgical masks,
Okay.
which offer you above 90% protection against viruses, which would spread through passing through airborne viruses or water or particle or droplet, I mean. And the best, of course, is the N95. It is called N95 because it has 95% protection against germs. So it would still give you at least above 90% protection from this. However, as we say, these are not foolproof methods. The best way is to avoid people or situations where you will get in contact with people who are coughing, sneezing, or where the particles may be so densely concentrated, like markets, schools, or where. That is why they probably closed the schools.
Okay.
I would like to share an example of the N95 mask that people talk about. This is what it looks like for those who haven't seen one. This is the N95 mask.
Okay.
Thank you.
Well, thank you, Dr.
Yeah,
Keith.
but you see, the understanding is that ideally masks should be single use. If you put it on, when you get to put it off, when you want to put on a mask again, get another one. Because they are prone to getting soiled, becoming damp, getting torn, and when all these three occur, they actually increase the risk of acquiring respiratory tract infections. There is a study that actually compared people who are wearing the surgical mask and those who are wearing these cloth masks. Wearing these cloth masks increase the risk of infections, respiratory tract infections. Of course, it's because people they are reusing them, they are not taking good care of them, and so the risk is really higher. And so, should you wear a mask if you are not sick, if you are healthy, you have no complaint at all? There is no need for you to wear a mask,
Okay.
unless if you have symptoms, you are taking care of somebody who has symptoms. If you're a COVID patient, you're a COVID suspect, or you're a health worker, then you can wear a mask. But if you're healthy and going about your business, there is no scientific evidence to support you putting on the mask. The WHO, the CDC, and even our Ministry of Health does not recommend that health people should wear these masks.
So which means you now have seen very many people, actually some are putting on the handkerchiefs.
Yeah.
They're putting on handkerchiefs and moving around, and others with some little money have bought masks. But as the doctors have told us now, it is not very important that somebody puts on a mask and walks around with it, and tomorrow morning he puts on the
Fixes it
same mask
again.
and walks around. I wanted you to make a mention about hand washing. Hand washing.
So I think the message has been consistent throughout from all the media channels. It's important for you to wash your hands. And the washing should be preferably with soap and water, running water, and to be at least 20 seconds. To estimate these 20 seconds, you probably, people say if you washed your hands while you are singing the happy birthday song twice, that approximates the 20 seconds.
Okay.
The second best option is that if you don't have soap and running water, then it's to use the alcohol-based hand sanitizer. But the alcohol should be at the very least 60% of the strength. And that could help with disinfecting your hands. It's important, somebody's going to ask you, how often should I wash your hands? And that's a very difficult question. No one has given a conclusive answer.
Yeah.
For me, I would say, if you can, every hour you should have a hand washing moment. Probably to be important in reducing the number of viruses that might be on your hands. Why this is important is that every time we are touching surfaces, you are touching microphones, you are touching tables, keys, pens. So it's important for you to continuously wash your hands.
Okay, thank you so much. I come to very important, as Dr. Baruch has put it, that we must keep washing our hands. Those who can afford sanitizers, please, at least every hour, just to approximate, you need to wash your hands. Allow me to broaden it a little bit to a very personal question from each one of you. Are you satisfied with the national and global response towards COVID? Because everyone there, as they are locked up in their houses, they want really to be assured that their countries are doing their best to prevent the spread of this infection. Are you satisfied with the national response and the global response?
So I think I'll go first, then
Dr. Keith will
Keith
complete.
probably is more. It's more of his technical area of response, and I think there are three things, the three T's. One is tracing, finding people who might be suspects or who are contacts of those who had COVID. Are we doing enough in tracing? You know, we had challenges as Uganda. People came in, they disappeared, and then we had to look for them. We're asking them, please come, we are looking for you. Yet I think that should really be enforced. It should be enforcement, not it's not a
begging.
negotiation.
Yeah.
It shouldn't be a negotiation. So tracing. Two is testing. Are we doing enough testing? Definitely not. But that's understandable. It's not only Uganda which is struggling with the testing. Even America is struggling. The test kits are few. There are tests that are being developed right now which have a short turnaround time where we can get results probably 15 minutes. But even those have not yet been validated to be sure that will give us correct results. So testing is a problem. In Uganda, I think they have established hubs, places where you can deposit your sample and then it is transferred to Uganda Virus Research Institute, which is the only testing center. I think we're not doing enough. The last T is treatment. I think we have 23 cases. We have a treatment center in Entebbe. I think, as you've heard, people are recovering very well and steadily. So we are yet to know whether we are doing enough with regards to testing. So I think there are still glaring gaps. We do not know the economic impact the measures we have taken are going to have. We do not know the psychological impact of this quarantine and isolation is going to have in the long term. We do not know how many people are going to die because they can't access health care, because the healthcare system is so busy taking care of COVID, or they are quarantined somewhere else and they cannot access healthcare. We do not know. So there are many things, like I said, we shall know in hindsight that this worked, this didn't work.
Okay, thank you so much, Dr. Keith. What's your take on the national and global response to combat COVID-19?
I will say, as the English said, that the sweetness of the pudding lies in the testing or the eating. You'll know how sweet it is by what you test. With regards to this, you have to understand the phases of an epidemic like this one. First, the imported cases, then the community transmission, then eventually it can reach its peak, and then hopefully all people who would have gotten it have been reached, and then it begins doing what? Coming down. We so far seem like we have managed to contain it within the imported cases. As he mentioned, at that stage, contact tracing is very important. Intensive case finding, looking aggressively for all cases, which I think to see the government is doing a bit passively, because they call people to return, and it's not easy to find people in a big country like ours. If you know, even tracing patients who are lost for other diseases is not very easy. But we are so far not reported so many community cases. I think so far only 2, the child in Iganga, the baby less 8 months, and the gentleman in Adjumani. Time will tell whether we are moving towards the community transmission phase, which will need even more intensive case finding and more resources to find and isolate these individuals so that they do not spread it to the others. So there are 3 I's, as he said. Isolation of people who have building on his 3 T's. our neighbors and the outside world in order to avoid a big spread of this disease.
Okay. Thank you so much, Dr. Keith. So as of now, Dr. Keith can comfortably say that probably the country has done quite enough to ensure that the population is protected
More for intensive case finding.
for intensive case finding. But again, Dr. Baruch raised some contention on testing, which he termed as we may not be doing enough.
That's
So we
part of
cannot-
intensive case finding.
Case finding. So, okay. So which means if we up our testing, or that is case finding, and then we take away all the cases into treatment areas, then we're sure that we can reduce on community transmissions.
If we also take protective measures to flatten the curve.
Curve.
We spoke of flattening the curve. Stay home as much as possible.
Okay.
Avoid moving in congregate settings. Wash your hands regularly.
Okay.
If the president directs even more drastic action, avoid public transport. He has a reason why he's avoiding the jam moving from Kampala to Kamuli, Kampala to Kanungu. In a short time, it can move very far and very fast and cause a widespread epidemic. So he's probably indirectly telling you, stay home so that you avoid being caught up in this. And by flattening the curve, as you see on the screen, you'll be able to allow the health system to deal with this at that lower level, and people will stay alive and healthy.
There was actually a paper published, I think, about a week ago or 2 weeks ago. And it's a modeling paper. What these scientists do is they create scenarios to help them estimate what is the risk if this happens. And they estimated that public transport currently will increase your risk of getting COVID by 20%. Yeah, so the decisions are not out of the blue. They have impact. They have scientific backing. The more reason we should adhere to them.
Thank you, Dr. Baruch. As we come to the conclusion, the doctors here, one a medical doctor, and Dr. Keith a medical doctor, but this one is a specialist in internal medicine and is a specialist now in public health, protecting masses and promoting health. They consistently agree with the measures that the president have taken. Therefore, we appeal to the population to make sure that they abide by what the president has put forward. Dr. Baruch is also a businessman, and I don't want to leave without them painting an economic impact of this epidemic, because currently people are saying we are not working, we do not have food. What if we get malaria? Where are we going to get money to treat the malaria? We have all these diseases, they have not gone. So which picture do you paint of the impact of this epidemic in the next 6 months?
I'm not certain if I'm the right person to paint the economic picture.
Okay.
But you see, right now we can make so many hypotheses. We do not know the economic impact of continuing business and we get 1 million cases. We do not know the economic impact of that. And so the world over, we are all struggling with the same decisions. Is it too much? People said that the president of China took on draconian methods to close the entire city, close systems. 4 months down the road, they controlled the epidemic. They reported, I think, 5 cases, five deaths
as of
yesterday. Very small numbers.
Yeah.
So I would think that we are all thinking hypothetically, and there are so many answers we shall have 2 years from now from the things that we did. So I'm not in the best position to paint a picture of the economic impact.
Okay. Keith, what do you see in the next 6 months in regards to COVID?
Of course,
19.
this is a bitter pill. Like if they told you to take chloroquine as medicine, of course.
Yeah.
I remember the days when we used to take chloroquine and quinine. Those were very bitter tablets.
Yeah.
I would like to, and if you look at the dollar is tending towards already 4,000, meaning that there's already an economic impact. Someone said Ugandan population 70 to 80% is double Z, Zenkola Zendia.
Yeah, true.
I survive on what I eat today. So telling someone not to work for 1 month is very catastrophic to some.
Yeah.
Of course, you are going to encourage some to become robbers, as already you can see. And however, as Joseph said, if we don't control it early, we are looking at a situation whereby we can shift from imported cases to community cases, and we can, from that point, it becomes an Italy situation. We don't know how it will turn out. The economic cost of that one is grave. Assuming that we maintained it as imported cases and we buy time for those 23 or 40 or 50 people to fully clear and remain isolated, possibly that we can test the whole group and know where they lie, and we have pulled out all those people from the group. We are talking about a period of 2 weeks to 1 month in which we have cleared those cases, and we have lost probably a month but saved 6 months of economic time. That is the thinking around this, that if we have cleared all these imported cases and a few who have managed to spread through, and we have them in incubation and treatment for that period until they are cleared, then we are able to stay healthy as a community and become an example for others on better how we can control this epidemic early.
Okay. Thank you so much, colleagues, for the wonderful input on this conversation about COVID-19. We need to have some parting remarks because time is not our best ally.
So do we have any questions from our viewers? I don't know if somebody has been collating some questions for us.
We have one question. Okay. Can you summarize it for us? Or you can give it to me and have a look at it? Okay. Okay. Somebody is asking, can we have an explanation on the development of a possible treatment for COVID-19?
We addressed that.
Okay, we've already
addressed most of that question.
Most of that question, okay. Thank you so much. Colleagues, parting remarks and appeals.
So I think the parting remark will be the same, that the consistent message that is going out, remember to wash your hands regularly, keep social distance. 2 meters is the minimum you should keep from the person near you. Stay at home. Remember that it is only you who can not live without you. You know, everybody else can live without you. It's only you who cannot live without you. So
by the grace of God.
Thank you so much, and we shall have a prayer. But before we pray, I want to thank my colleagues, Dr. Baruch and Dr. Keith, for the wonderful conversation. And I want to also add that we need to keep safe, we need to eat well, and keep our spirits high. Have enthusiasm that one day we shall defeat COVID-19. I will offer a closing prayer before we come to the close of this conversation. Thank you, Lord, for the wonderful time we've had about the talk on COVID-19. Everyone is scared, and we cannot wish it away that we are at a terrible time. But we are again enthusiastic, and we are again hopeful that even this one will come into our past, and we shall move on gloriously and with a lot of energy. We put the families of those which are affected, those who are in quarantine, and those who have lost their loved ones across the world. May you please comfort them. May you please talk to them in a special way. And may you please talk to each other person who is suffering because of the repercussions and the outcomes of COVID-19. I continue to put the Ministry of Health and all doctors and everyone who is responding to this epidemic. May you give them the energy and the zeal not to abandon patients but to take care of them. In Jesus' name I've prayed. Amen.